So, welcome back, everyone, to the Green Path Psychotherapy Podcast. My name is Alex, and I'm joined by my colleagues here today, Gianluca, Jess, and Rebecca. And today we're going to be talking all about safety and our window of tolerance in a traumatized body. I think it's about time that we finally talk about trauma, considering we are a trauma specialized clinic. And also because there's been such a boom in so many different researchers and clinicians actually bringing this to the forefront of research, psychological research. So we're learning now that trauma isn't just something that is in the mind or it's an emotional whatever disorder. It's something that actually manifests like physically as well. And we know the big names like Janina Fisher, Gabor Mate, Bessel van der Kolk that are all talking about this. So today we're going to be talking about what trauma is and how it actually impacts a person on a day-to-day basis. And also, what do we see as clinicians who work with so many people who come to therapy for trauma? And so a good place to start is maybe we'll talk about what trauma is. Like, how do you define trauma? How do you see it show up in your clients?
What I would say, there's many different ways that, different theories that people will view the lens of trauma through. But one that I find to be helpful is particularly EMDR views trauma as basically any experience that would have had a significant enough impact on your nervous system that it continues to be present in your day-to-day. So within that definition, trauma isn't something just like what we call a big T trauma, but it could be any sort of event that would have been impactful. And so within that definition also, it includes basically any mental health disorders would have a trace back to a trauma. So, I think people often misunderstand trauma as like it has to be something super big, but it can also be things like neglect or, like many events over time, like bullying or something like that. So, yeah.
Yeah, I think like Rebecca, you make a really great point, right? Like it could be, like I was in a car accident in 2009 hitting a moose in New Brunswick, and that was traumatic because I struggle now to drive at night because it happened at night, right? So like that's a big T trauma, right? Versus like, if someone has experienced like microaggressions throughout the course of their life because of racism or sexism or, homophobia, that is also trauma, even though it might be like smaller little things it's on a regular basis that affects your nervous system over time.
Mm-hmm. Another way, and it echoes a lot with what's just been shared, is call it looking at trauma through a functional lens. What does that mean? It means what are the experiences, the negative experiences that you've had in your life, which in the present still get triggered, still get brought up. And the functional aspect of it is how those triggers and your responses to those triggers get in the way of, let's say, the life you want to lead, how you navigate relationships or things that certain things you want to do for yourself. And that kind of gets to, let's say, another common misconception about trauma, which is the idea that big T or small t, whether it's a trauma or not, is defined by the nature of the event, which doesn't necessarily have to be the case. Like trauma is as much about the event as how you relate to that event and what it brings up to you in the present day. So you can have two people who get into a car accident. One of them, let's say, is shaken up by that, and we can explore all the reasons, let's say, why that happens and then work through them, but they're afraid of getting into a car the next day, so on and so forth. Another person might get into a car accident and just for whatever reason, it's neither good or bad, that simply doesn't register. They can go back to driving right the next day, even though they were within an inch of their life. That's kind of just a simple example to explain how the trauma lies in also the subsequent reactions and how we deal with them today, how we're triggered, how we feel in our body, and what we do with those sensations, in as much as the event itself.
Yeah. It speaks to the subjectivity of trauma, but I also think there are some factors that do contribute to the outcomes of a traumatic event. So for example, like how often is a trauma happening, right? Is it repeated trauma? Someone's social system. So if people do have a strong foundation of people that they can go back to process the trauma, or if they feel well supported, if they feel safe enough to disclose that a trauma happened to them, the developmental stage that a person's in, because there are going to be like critical periods in one's life that can impact them. So that's more of like developmental trauma. I think also things like baseline optimism, this is more like personality traits, as well as someone's already baseline resilience, right? Like all of these things are going to impact the way that we actually process an event, and whether or not it could still be a significant event, but it might not be traumatic, or it could be highly traumatic to some people. And then there's also different categories of trauma, right? Acute trauma, so a single event trauma. Complex trauma is more repeated trauma. The developmental trauma I spoke about, intergenerational trauma, so something that might not have even directly happened to a person, but the impact of trauma on, let's say, caregivers and how that person has acted towards their child can impact a person, their secondary or vicarious trauma, even just by virtue of listening to someone else's trauma. So all these things can impact a person. And I think it's important to even understand how it can be so complex in that sense when we're talking about trauma. Again, the little t, big T trauma. But I think another trait of trauma, or how we know whether or not we have been traumatized, is the hypervigilance. That's a core trait. So how activated is your nervous system to different things in your environment that might not actually be dangerous, but your nervous system is perceiving it as dangerous. And one of the things I found with working with clients is the word safety can feel so loaded for people, because they're like, I don't even know what that means. And so maybe as a question to you is, how can someone perceive safety when they have such a hyper vigilant nervous system?
Safety is about reducing the hypervigilance of that nervous system, right? So it's not necessarily about like, I feel safe. It's, can I reduce the intensity of what I'm feeling? Can I get back in my window of tolerance, so to speak, right? And so if someone's triggered, what will happen is we have this window of tolerance. We're sort of up and down with our nervous system naturally. And then if they get triggered, they sort of shoot up, right? And then they'll often crash back down afterwards, right? So they'll go way up, they'll go way down. And that's a sign that they're like outside of that window of tolerance. And so bringing them back into that window of tolerance really is in alignment with the idea of safety, right? And so even if they have a smaller window of tolerance, it's like, how do we navigate sort of having this smaller window versus somebody who's maybe experienced less trauma, whose window is a little bit wider and a little bit easier to navigate the ups and downs without sort of crashing out.
Yeah, another thing about and window tolerance, I think we'll talk about that, but more in more detail. But I think that, when somebody is feeling unsafe, it can also make people feel unsafe with others. So I think there's also a sense of, not only am I unsafe in my body, but I'm unsafe with others. So it does create this tendency to protect, to be hypervigilant. And also that's why sometimes we can see that safety can actually feel threatening, because it's them putting their defenses down. And so part of it is about making sure to relearn what feeling safe in your body is like, and also to learn that being safe enough is not unsafe, if that makes sense. Not going to lead to trauma. Yeah, more trauma.
Took the words right out of what I was about to say, Rebecca. Very much emphasizing that, particularly for people who are experiencing hypervigilance as a traumatic reaction, where you always have to be on guard, always careful. The very nature of getting back within that window of tolerance and learning to do that even through therapeutic work is one that will inevitably involve the discomfort with tapping into an experience of comfort and safety, right? And so it kind of also brings up, let's say, exposure therapy principles. Exposure therapy basically being like, whatever you're afraid of that you have to confront, to do so, you have to continuously expose yourself to it and acclimatize to that, and recognizing that this thing that I think I'm afraid of isn't actually dangerous in 99% of the context where I encounter it. Same thing applies to the very experience of being okay and not being on guard. So, yeah.
Totally. I think that also reminds me of that point of like, the whole trusting your gut. With a traumatized gut, it's hard to trust because the gut can already feel like, oh, something is dangerous when it's not. And so it's hard to follow our own intuition when it's so loaded with like bias and the experiences that we've had before. And so even that piece is working with your clinician to identify, hey, what is like a real threat? What is a true trigger versus something that might not actually be threatening to the nervous system? That can be really hard as we navigate the world. And also when lack of safety has felt so familiar to a person, and that's why people who have, let's say, experienced childhood trauma tend to gravitate towards dangerous situations, including dangerous relationships, more frequently than someone who hasn't. That's because that's what the nervous system knows. So even if objectively we could say, hey, you're putting yourself in a risky situation that looks like a dangerous situation, to the traumatized person, they might not perceive it as that. So it's almost like in therapy, learning to reset what it means to actually be in danger versus that perceived danger. And I guess on that note, understanding how trauma does impact our own window of tolerance. So how do you think it does that?
Well, I think as I mentioned, it makes it smaller a lot of the time, right? So like, what you can handle becomes, slimmer, right? Versus what sort of makes you feel unsafe becomes sort of the bigger space, as it were. And so, it sort of takes time working, in therapy or, with yourself as well, like outside of therapy, to like expand that window of tolerance so that what feels safe is wider than what feels dangerous.
Maybe to break it down in also, let's say, very, very simple neurobiological terms, trauma therapists often educate clients on what's called the triune brain or the three-part brain. There is the brainstem, which is connected to, let's say, physical sensations, heart rate, certain, let's say, bodily functions. The amygdala, which is, let's say, emotional memories, that experience of this or that puts me in danger, this or that is unsafe. When we talk about being quote unquote triggered, that's the amygdala getting activated and then sending signals through the brainstem to the rest of the body to like, okay, heart rate's up, get ready to run, that kind of thing. And then there's the, let's say, the higher order functions in the prefrontal cortex. That's our reasoning mind. That's our ability to actually see information for what it is, reason about it. Okay, this might seem scary, but the more I think about it, it isn't scary. What trauma does is it overactivates, let's say, the amygdala in response to specific triggers. And so it's almost, think of it as that part of the brain overpowering the reasoning part of the brain. That's kind of like the brain way or the neurobiological way of interpreting, let's say, the window of tolerance and the notion of trauma itself, whereby a given trigger excites the amygdala and our physical response, and then our mind starts racing so much that the prefrontal cortex, the reasoning part of the mind, gets disengaged. And so on a neurobiological level, the work of trauma-focused therapy involves learning to re-engage that part through positive beliefs about ourselves, through being in touch with a certain awareness that whatever my reaction isn't actually, let's say, in tune with the reality of how in danger or not I am. And so you can kind of describe that as then expanding your window of tolerance, where you're able to stay engaged with positive self-beliefs and emotional experiences that don't get you out of that, let's say, what we often call as fight or flight mode.
Yeah, kind of what Gianluca was saying, when within the window of tolerance, there's something called hyperarousal, hypoarousal. Those are two different systems. Hyperarousal is your nervous system being active. So think fight, think flight. You're very active in that state. Whereas hypoarousal would be a shutdown of the nervous system. So actually it's inactive. Sometimes they can kind of, overlap or whatever. But these are kind of systems that people will sometimes you'll see that they'll gravitate towards one or the other, depending on what the trauma demanded them to do. And as Gianluca was saying, what happens when you're in a survival mode is that your frontal lobes, the parts that's responsible for memory and thinking and speech, all the things necessary to really process things is shut down. So because of that, it can make it very challenging to discern what is, the threat, what is not, and to have rationality sometimes in those situations. So yeah, so it can make it very challenging to also know when to regulate and all of that. So just something to note about trauma, that a lot of the work is about learning that to regulate in between those moments, right? Talking a little bit about it, and then also regulating and learning that both can be true, that you can have that experience and know how to regulate, and it's not unsafe anymore.
And just to note on window of tolerance as well. So when we talk about hyperarousal or hypoarousal, finding your window of tolerance isn't the absence of stress, because it's okay to get activated by things. In fact, stress can be highly beneficial when it comes to productivity. The window of tolerance, and it's subjective, everyone has their own thresholds here, but it's a threshold of stress. So when it starts, or when the nervous system starts to overwhelm itself, that's when it can go into the hyperarousal or hypoarousal. And so finding the window of tolerance is really what's the manageable level of stress that each person can really experience. And so on that note, we've been talking about what we do in therapy, like through exposures, it could be EMDR, that psychoeducation around what's happening in the brain, as well as how do we differentiate between, what's danger versus perceived danger. But what's something that people can do to expand their window of tolerance at home? So it might not necessarily mean processing trauma on your own, because I wouldn't advise doing that all by yourself. But if there's something that people can do, maybe as an even starting point to help them start to expand their window of tolerance, expand that threshold for stress, especially when they have experienced trauma.
Yeah, I think it's so important to tune into your body, right? So like so somatics is like what I've studied, right? And the idea is to like be aware mindfully of what's happening in your body, be aware of your body sensations, because a lot of trauma can cut us off from our body sensations and make it sort of unaware of what's happening. And then when we're not aware of what's happening, it sort of dictates our behavior as opposed to allowing us to dictate our own behavior. And so tuning in is like a starting point of like, what am I noticing in my body? Just noticing, right? Not trying to change it, not trying to like influence it anyway, but like, what can I notice is happening?
And how would someone go about doing that? Is it like a matter of like sitting down and just going through their like different parts of the body, or is it when they're starting to feel a shift in their body to just kind of tap into that?
Both, I think. I had a client in my office this week and I had her standing and rocking side to side and just noticing how it felt. Right? Just noticing the sensations that were happening, noticing like what it felt like in her body, what her heart rate was doing, what her breathing was doing, what it felt like in her legs and her limbs, like everything that was sort of occurring, and sort of describing it to me as it was happening so that she could bring that to her awareness.
To expand on that, I think that awareness is really the first step of, whether that be learning like education on the window of tolerance, for example, knowing what the symptoms of like hyperarousal, hypoarousal are. And then once we kind of know that, then we can learn, okay, well, what do you do for each of them? Because they do require slightly different regulation techniques. So hyperarousal, because the nervous system is active, when we know that that's maybe our tendency, or know the symptoms, then we can do things to relax the nervous system. So think breathing, think meditation, grounding. Whereas if we're in a shutdown, knowing that, maybe we want to actually move our bodies, like activate the nervous system a little bit. So like go for a run, screaming, singing, dancing, things that will those will be the regulating things for that. So yeah.
What I can add to already these very great points and distinctions are maybe, let's say, two very quickly, let's say, strategies that I find I encourage, let's say, clients to use. These are very more so typically oriented for, let's say, call it hyperarousal. So the hypervigilance, the restlessness, the anxiety. One, which is in the theme of, let's say, mindfulness and awareness, is you can do this while going on a walk, you can do this while sitting at home, but whatever is preoccupying you, treat it as though they are clouds, the thoughts, that is. Treat them as though they are clouds passing in the sky. So you're noticing them. Your mind is the sky itself. Whatever is on your mind, including these thoughts, these emotions, these desires to react, they are just clouds passing in the sky. So that's one way of, let's say, beginning to practice that skill of being awareness, particularly for people who perhaps, getting in touch with their bodies might evoke a different reaction than one that actually, let's say, feels like regulation. It's noticing the content of their thoughts as things that are also just transient. They're thoughts and nothing more. The second is, let's say, tapping into sources of resilience. This can be done through journaling. It can be done through, I don't know, creative processes like listening to music, or I don't know, any number of creative ways of channeling. I typically focus clients on one of two things: an ally in their life, real or imagined, but some kind of human figure of somebody who believes in them, knows that they can get through whatever difficult experience they're having, and channeling, let's say, thoughts and emotions around that. Another one is thinking of a previous resilient chapter in your life, a time in your life where, things were really tough. They felt difficult, but for whatever reason, you had much more of like, I can get over this kind of spirit. It's time for me to rise to this occasion, quote unquote. Really reflecting on that, I find through journaling, it really kind of helps the mind start going, can kind of help somebody really reorient their mind away from, here is these distressing experiences that I can't do anything about, towards, I have some way of relating to this challenge or this trauma differently. So yeah, there you go. Two ways of exercising what would bring you back to your window of tolerance at home.
Yeah. Really helpful starting points. And so hopefully this gives viewers just an understanding of what trauma is. And if you are someone who is experiencing any of this, I highly encourage you to speak to someone about it. Holding it in can really manifest in all these ways, and that's why trauma can be so debilitating. And if you have any questions, you can always reach out to our clinic. We're always happy to talk to clients, even offering a free virtual consult. But I appreciate you all joining me today, and until our next episode, thank you, everyone. Bye.